Good afternoon, Elwood community. This is Superintendent of Schools Ken Bossert with a delayed weekly update. It's been some time since I recorded a message for you. You've been receiving daily letters, which have been such a pleasure to write, but it's been a bit of time since our last video update. So I want to begin by wishing everyone a very happy holiday season. On behalf of myself, the Board of Education, and the entire administration, we hope that you take the opportunity this holiday season to find some joy among some of the challenges that we are experiencing and really find time to appreciate what we do have rather than the things that we currently do not. Particularly our good health, which I hope this message finds you all in. Just a few things that I wanted to update you on, and I'll try to be less wordy than my last update. Next Thursday, the 17th, is a public meeting of the Board of Education. As you know, we live stream all of our meetings on the website for those that are not comfortable attending or those who simply are more comfortable attending from home. Dr. Hull and members of the curriculum team and building administration will be presenting some really great enhancements we've made to our learning program this year. With so much focus on health and safety, I think it's appropriate that we take some time to reflect all of the efforts and initiatives that have been going on to make sure our students are receiving an optimal instructional experience. Despite some of the restrictions that we're working under, our teaching staff and our administration have really done a wonderful job of finding creative ways to meet the needs of our students. And the curriculum team will be highlighting some of the additions and modifications to our program, focused a lot on our instructional technology that I think you'll be interested in. So please, I know we spent a lot of time talking about health and safety items. Instruction here is still a priority, a top priority. I would very much encourage you to view that presentation either when it's taking place next Thursday or the archived video of it. And thank you to everyone, our teachers, our administrative staff, our leadership team, Ms. Albrecht especially, who has helped to move our technology program forward in the instructional way. Back to health and safety item. Thank you very much, as I wrote in the letter, to everyone who responded to the interest survey regarding COVID-based testing in the schools. You will begin hearing about more and more districts who are required to test based upon their designation of being a yellow zone as per the New York State Department of Health and the Governor's Office. We are not. We don't have any designation at this time, but we are ready in the event we are designated a yellow or orange zone. And my letters have done as best I can to explain all of that criteria. All of those letters and communications are archived on our website with links to different sites for clarification, so I'll just keep it simple. If we're required to test, we will need to test 20% of our overall population of folks attending our buildings. We have received more than ample volunteers from both our student population, thank you parents, and our staff. And I really have to commend the staff. Over 90% of our staff said that they would voluntarily participate in a COVID testing program, which we are very, very thankful for. Our faculty, our staff, our administration, the board is heavily, heavily invested in keeping our schools open and safe for our students and their families. And their commitment to participating in the testing program, should we need it, is a demonstration of that. Further, our community has demonstrated their passion for keeping our schools open and safe. The survey that I asked if members of the medical community who reside within Elwood would be willing to participate as volunteers in the testing. 23 different individuals, doctors, nurses, clinicians, pharmacists have volunteered to assist. And I'll be meeting with them tomorrow to go over the particulars of the testing program that's been developed in collaboration between the Suffolk County Council of School Superintendents and the Suffolk County Department of Health. And I have to thank the Suffolk County Department of Health, Dr. Piggott is an Elwood resident, the chief physician for the county, for their partnership. This is not something we could do in isolation. The tests themselves are being supplied to the Suffolk County Department of Health. And if we are designated yellow, we will need to test approximately 400 students and staff members. In each of our 4 buildings, that means about 100 people per building. We would likely do more at the middle school and the high school than we will Harley and Boyd, but it needs to be a random sampling, so it would be about 100 people per building. That said, any student, we will need official written consent, so there will be a follow-up to the survey that you responded to. And any student that becomes uncomfortable at all, or staff member for that matter, at having their nose swabbed will simply be removed from the line. We have more volunteers than we need, so no one will be forced to take the COVID test. This is not the test that swabs and tickles your brain. This is a rapid test that is a quick nostril swipe of each nostril with a Q-tip. I think I mentioned once before that in a district upstate, the students tested themselves. We will not be doing that, but that is a demonstration of how easily the test is done and how painless it is. But thank you to the 23 members of the Elwood medical community who have volunteered their time and will be meeting with me tomorrow to discuss the particulars of testing. It really does take a village. This is an example of it. And I really have to thank and commend all the parents who have been so cautious with their students and sending them to school. Parents have been communicating with their health offices, and our nurses are working so hard right now, and we thank and appreciate their efforts to communicate with families when there are questions, when there are concerns. Symptomatic children are being kept home. We are being very cautious. We are working out of an abundance of caution in many, many aspects across the board, and everyone is complying with the guidelines that we have in place. We have seen some COVID fatigue, so we ask parents to remind their students of the importance of mask wearing all the time. Breaks are given, but the mask needs to be on and on properly over the mouth and nose at all times. Hand washing, and appropriate distancing. So we can't allow COVID fatigue to set in at a time where we're seeing such a surge in the COVID infection rate for those tested. So please, if your child is exhibiting any symptoms, please keep them home. A few of the cases we have had, it has been attributed when families have failed to do that. And please keep in mind, if there is a positive case within your household, the entire household is subject to quarantine as per the Department of Health. A singular positive case means every household member, every member of your family, or anyone that resides in your home is directed to quarantine. Quarantine does not mean simply staying home from school. It means isolating within your home, not leaving for shopping, not leaving for recreation activity, certainly not leaving for socialization. We're hearing far too many reports from parents who are observing neighbors that they know were directed to quarantine, simply ignoring it. That will not help decrease the infection rate in our region. That will not help to keep people healthy. That will not keep our schools open. We must all do our part to keep each other healthy and safe, and most of all, our own family and friends. So please, it's very difficult as a school district to be in a position to have to direct quarantine. We did so today. Today's case was complicated. It's why I struggled to write the letter. It was a singular family with 3 siblings that happened to have 1 child at Boyd, the middle school and the high school. The children have not been in school in some time, but when they were in school, they were symptomatic. So according to the Department of Health guidelines, the 48-hour look back that I've referenced many times is from the time where they were symptomatic and exposed to other children and staff members, which is why the quarantine period is just an additional period of time from now, not the full 14 days from today. For an asymptomatic individual, it's 14 days from the time of the positive test. For a symptomatic individual, it's 48-hour look back from the time of the onset of symptoms. Things I never thought I would know or understand prior to March that I unfortunately have had to become very fluent in, as has the leadership team and the health offices within our buildings. We know what we're doing, and we are following the guidelines very closely. So when the school district makes a recommendation, we then submit that information to the Department of Health, and you will hopefully receive follow-up from the contact tracers within the Department of Health. The contact tracing is behind. The system is a bit overwhelmed. So emails that you may have received, calls you may have received within 24 hours months ago, sometimes have a day or 2 or 3 lag. It's important that you know that when you receive a quarantine notification, you're also supposed to receive a quarantine release on the day after you are supposed to be released. If you do not receive that, you can request it. You can go to the website, enter your information, and you can simply print it out. That's something we require after a positive case to return to school. Parents, again, You've been doing a wonderful job communicating with the buildings, with the health offices, with our nursing staff, principals. Please keep up the good work. But it takes everyone. It takes everyone. A singular case, depending on the child's age and the building that they're in, can force the quarantine of just dozens of children and staff members. That was the case today. You know, unfortunately, you know, no one wants COVID-19. No one wants to be sick. No one intentionally exposes themselves to this virus, but it does occur. And for this singular case that we had, you know, 3 siblings, but 1 family, you know, nearly 75 individuals needed to be directed to isolate and quarantine. And then again, it doesn't mean just not coming to school. It means isolating within your home, which is not an easy thing to do. Many of you have had that experience. Many of you are experiencing that now. It's not fun. It is a challenge, but it's what we have to do right now to keep each other healthy and safe. I hope that this holiday season gives you the opportunity to find some joy, to find some comfort in being with one another. The downtime from school that will be coming in the coming weeks, I hope is time that you spend, you know, enjoying family, enjoying the things that bring us together during difficult times. It's not all doom and gloom. Trust me, while this message has that tone to it, when I walk the hallways, when I'm in the classrooms, when I'm visiting with the students, there are some things that are very much business as usual. Things may look a little different, but the interaction between student and teacher remains the core of what we do, and it's just as positive as it's always been. And I thank our faculty for keeping it that way. So all of that said, I'm sure I will create another message prior to the holiday season, but happy holiday season to everyone, and please stay healthy and safe.